Hi there, it's me, Dr. Daniel, and in this video, I want to talk about post-COVID or long COVID syndrome. While most people who get exposed to SARS-CoV-2, the virus that causes COVID-19, usually these individuals will have mild to moderate symptoms that really resolve on their own. Some individuals are experiencing lingering symptoms, and this is now being described as long COVID syndrome or PASC, post-acute sequelae of SARS-CoV-2 infection. Now, before diving in, here's some background information. First of all, on December 31st of 2019, 27 cases of pneumonia of unknown origin were identified in Wuhan City, China, and eventually the causative agent was identified by the Chinese CDC, which was on January 7th of last year, 2020, and they named it Severe Acute Respiratory Syndrome Coronavirus, SARS-CoV-2. The disease was named COVID-19 by the World Health Organization, and this was on February 11th of 2020. So again, SARS-CoV-2, this is the virus that we could get exposed to that for some individuals eventually results in a disease known as COVID-19. Now, think about this like a lot of other viruses. Let's say, herpes simplex virus. It's well known that depending on the type of actual herpes simplex virus, there's different types of viruses, just like there's different types of coronaviruses. Lots of people have herpes simplex viruses in their body. If you've ever had a fever, a cold sore, mouth sore on your tongue or your lip, if you've ever been inoculated, immunized, there's all sorts of ways that we could get herpes simplex virus. You don't always develop disease from it, though. So you could have these viruses that are in your body and it's not causing any issues. Actually, Epstein-Barr virus. Lots of people have Epstein-Barr viruses. Some people develop problems with it. Some people don't. You could have HPV. There's people that have HPV viruses. And the reality is even though there's a lot of people that get scared of it, 5% or less of cancers are going to be because of HPV. And out of that, again, it could easily be stated that 99% of the time you're not going to have any issues with it. So again, there's a lot to unpack with these viruses and the way that they contribute to dysfunctions. But in this case, SARS-CoV-2, that's the virus, causes the disease COVID-19. Now, the NIH published Trying to Make Sense of Long COVID Syndrome. And that's what we're looking at here. This was published back January 19th. Of this year, 2021. This was 11 months later. And this is really the largest global study on PASC and defined as a collection of symptoms during or following confirmed or suspected cases of COVID-19. And this usually continues for more than 28 days. So here's just a couple of details. The study details included 3,700 international patients. 50% of them never sought hospital care. 60% had symptoms 6 months later. What we're talking about here are people who did not have major issues with the virus. Again, they never went to the hospital. 60% of them didn't. But they developed symptoms that are still lingering. Now, certainly there's also a higher incidence between people who are hospitalized that end up getting discharged, and they still very much have problems, right? There's damage that occurs from this. Either way, whether you had a very bad bout of this virus or you didn't, this is really what we're talking about, long COVID syndrome, where these individuals are still having issues. Most common symptoms are going to be fatigue, post-exertional malaise, which is basically you exercise or you walk up a flight of stairs and you feel tired, cognitive dysfunction, you're having brain issues, brain fog, things like that, depression. Now, I think it's also important to note that how many people out there actually experience these symptoms anyway? If I were doing a survey and I went and stood outside some store and I asked, hey, do you have fatigue? How many people out of 10 do you think are going to tell me, yes, I have fatigue? Do you have post-exertional malaise? Do you get tired? Are you really run down after a workout? It's not going to be as high, but a lot of people are going to have it. Cognitive dysfunction. How many of you right now listening to this feel that you've got brain fog, memory issues, memory lapse, cognitive issues? Again, this is rampant. There's lots of people that already have these symptoms. But a key difference here is that symptoms are worse following exercise, mental activity, when you're really trying to think about things, whether that's calculating, problem solving, so mental activity. And then, of course, you have stress. Now, this is all very similar to traumatic brain injuries, TBIs, people that have brain injuries and they find that they start to develop these symptoms as well. So a lot of these, there's connections here between the pathophysiology of what could be happening. Now, a study done in Lancet in January 2021 showed that 6 months after symptoms showed up, more than 75% of hospitalized patients reported at least one symptom, which included fatigue, muscle weakness, sleep disturbance, anxiety, or depression. Now, there are actually a few papers that have been published on PASC, long COVID, and it all comes down to factors such as biomarker patterns, before infection, blood biomarkers that you can measure that we very much know there's patterns that would indicate that you're at high risk. So knowing these patterns before infection that can actually predict outcomes, how you're going to respond, how somebody handles the infection, either at the time of infection or how they're going to likely handle it afterwards. This is very much a part of what we're starting to be able to put together, where I could look at somebody's blood chemistry and I know how they're going to handle this infection, or how, if they get the infection, how they may handle it afterwards. And this is very much where a functional medicine model is so crucial. Knowing how to identify pre-existing issues, not simply waiting till you become sick and then addressing it after the fact. Very much so, I'm always looking for pre-diabetes, pre-immunological dysfunctions that could either pre-expose you to cancer, susceptibility to infections, inflammatory cascades that we can look at, nutritional deficiencies, right? All these things that we're able to look at through the lens of functional medicine, as opposed to conventional medicine that is usually reactive. You get sick and then you go in and something happens, right? We're trying to prevent that from happening. Taking all this information together, we know that the evidence of inflammation in severe cases suggests immunopathology, which may be inevitable in some individuals, or that prevention might be needed again before the onset. In other words, there's a lot that you could be doing to build up your body right now, and should have been doing actually this whole last year, to prevent this problem from actually happening in the first place. Now, here's the key takeaway when it comes to immunity. Number one, reducing inflammation or resolving the causes of inflammation in your body. Hands down, if you have inflammatory markers that are elevated in your body, high sensitivity C-reactive protein, just basic C-reactive protein, high ferritin, high uric acid, if your insulin is high, if cortisol is high, if ferritin is high, these are all markers of inflammation. TNF alpha, you can really dig down deep and get into some of these cascades, and knowing that, again, you can identify your risk. Optimizing mitochondrial function. The mitochondria are these structures that allow for the production of energy. So how our body uses energy. Are our mitochondria healthy, or are they dysfunctional? Reducing reactive oxygen species. Reactive oxygen species would be anything that can damage your tissues. Probably one of the best ways to think about this is, the sun's great for us, by the way, but I'm just going to use this as an example. If you go out and you sit in the sun for too long, you're going to get oxidative stress to your skin, and that is a sunburn. That's oxidative damage. But did you know that increasing your meat consumption, which most people don't eat enough meat, but increasing meat actually helps to reduce the oxidative damage from sunburn, which is quite interesting. Having healthy levels of fats helps to protect you. Enough vitamin D helps to protect you. So when we talk about reducing reactive oxygen species, you have to ask, what am I exposing myself to? What toxicities do I have in my body? What am I deficient in? What deficiencies do I have that could be contributing to this? Also, normalizing immune signatures. What does that mean? Well, very simply, what are your white blood cell counts? White blood cell counts would be an indication of the strength of your immune system. Are they high? Are they low? What are your neutrophils? White blood cells that are important for bacterial infections. What are your lymphocytes? including B and T lymphocytes. These are all things that if you're really concerned, you could look into. You could have these measured. For example, people who have low lymphocytes, they are 90% more likely to be hospitalized with COVID-19 than people who have normal lymphocytes. Now, let me show you here. I'm going to show you a chart. So let's pull this up here. This is a chart here that you can look at that really just shows you this was basically, there was this paper that was published where they were looking at individuals who were in the hospital, who were hospitalized with SARS-CoV-2, got COVID-19, they got the disease. They were either discharged or they died. Okay, so this is important to understand. And what they did is they were taking their blood and they were measuring certain cells. So what I'm just going to highlight total T cells. Again, these are T cells that are part of your adaptive immune system. Those individuals that were discharged, 773 was their number of T cells compared to 228. So if your T cells are really low, okay, that's going to predict your death rate. Look at helper T cells, 457 for the people who were discharged versus 139, a pretty big difference there. Suppressor T cells, 297 versus 80. And then just on a basic white blood cell count with the differential, which most of y'all probably have, what are your total lymphocyte cells? Look at this, 1160 versus 425. So again, we have means of measuring these things. And people with a less damaged immune system at the time of infection or hospitalization had a much higher chance of recovery. Well, what leads to less damaged immune system? All these things that I'm talking about in this video. Now, interestingly, there is also an unofficial, unpublished study or data that suggests that 1/3, 33% of vaccine recipients actually felt better from long COVID after vaccination, but 14% actually got worse. I think that's interesting. And again, I'm not saying that that vaccines are good or bad either way, but this is data, right? And this is interesting. What is the difference between those people who got long COVID, had trouble with it, got a vaccine and got better versus those who actually got worse? Can we tease that out and stratify risk? I think these are the questions that we should be asking, is how to improve physiological status and hopefully outcomes. But unfortunately, that's just not what's happening, right? Now, again, take all that for how you will or how you may. What are possible mechanisms that are related to long COVID? Well, we all know that diabetes is one of the high-risk factors. Hyperglycemia. This is an important one because, basically when we talk about hyperglycemia, we've all heard of these people, right? The healthy person who got COVID and then ended up going into the hospital, getting really sick, maybe even dying. Well, the first question is, how are you quantifying their health? Is it based on looks because they look healthy, because they're skinny, or because they, didn't have any pre-existing health conditions? But is that because they simply didn't have a diagnosis? I mean, there's lots of people walking around with problems. They just don't realize it. So again, before you assume somebody's healthy, you've got to know how to quantify that. How are you defining health? Realize that 1 out of every 3 people in the United States has prediabetes. And 90% of them have no idea. So right off the bat, 33% of the population is high risk whenever they get exposed to this. And yes, there are people walking around who look healthy, but they're pre-diabetic. So again, hyperglycemia, high glucose, that's absolutely a risk factor. Just because you're not sick doesn't mean that you're healthy. Health should be measured on how you are functioning, not on how you feel. We know diabetics have increased severity to COVID-19, and that's because of elevated furin, which really just increases viral docking mechanisms, meaning it makes you more susceptible to allowing the virus to enter. Glutathione depletion. Glutathione is a master intracellular antioxidant that has so many benefits within our body. And I'm going to say that almost every person living in the US is exposed to substances, medications which deplete glutathione, over-the-counters, Tylenol, ibuprofen, aspirin, all these compounds that you can take that reduce glutathione, pollution, all of these are examples that completely deplete glutathione to begin with. So again, it's not like you're going to walk around and automatically know that your glutathione level is low, or you're not going to go to your doctor and say, "Hey doc, I need to boost my glutathione." You're just not going to know that. But this is definitely a pre-existing factor. Nadph depletion. Basically pathways that are involved with antioxidant status, amino acid deficiencies. Lots of people have amino acid deficiencies. I mean, we just simply don't eat the amount of food, the right type of food, in order to have normal nutrient balance. So all of this leads to imbalances in mitochondrial function. Increased susceptibility to and adverse outcomes associated with viral infections could also be due to dysregulation of our innate immune and adaptive immune responses. Like I said, if your T cells are low, if your B cells are low, if your total lymphocytes are low. And this is a tough one because ultimately it comes down to how you've historically addressed infections. If every time your body was exposed to a virus and you suppressed your fever with fever reducers, or you took Tylenol or Advil or NyQuil or Theraflu, you never really allowed your immune system to respond appropriately. You basically suppressed it. Imagine going out and running a full marathon without ever having trained for it. I don't think it's going to fare so well. Your body's not going to feel good if you just go and do that. So, some of us are walking around with basically weak, inappropriately developed immune systems. Like we're walking around with entitled immune systems that, our immune systems have no idea how to survive in the real world. In addition, how healthy is your ecosystem? How healthy is the environment? The collection of organisms, your microbiome, the collection of good bacteria and other microorganisms that very much influence your immune system. Just today, I read a paper. This is from a great journal, Nature Reviews Immunology. I just read this morning, titled Modulation of Immune Responses to Vaccination in the Microbiota, Implications and Potential Mechanisms. Here's a quote. Although many factors have the potential to influence vaccine immunogenicity, so basically factors that impact the vaccine's ability to create an immune response and therefore effectiveness, increasing evidence from clinical studies in animal models suggests that the composition and function of the gut are crucial factors in modulating immune responses to vaccination. In other words, the microbiome influences immune function to SARS-CoV-2. And as I stated previously in my other videos on the virome, it's not just attacking these viruses that we need to be thinking about. That's I think the wrong way to be thinking about it. But how your body or the environment is going to properly work with them. Is your body, set to work with them? And the microbiome, again, is the collection of healthy organisms. What are we putting into our body that destroys these organisms? Antibiotics is a big one. And so here, if you have a history of taking a lot of antibiotics, or you take antibiotics regularly, chances are your vaccine's not going to work as well for you. But either way, certainly this paper demonstrates that vaccine efficacy improves with a healthier microbiome. But that also means that a healthier microbiome in general naturally results in improvements of how you'd handle a natural infection. And then also just yesterday, Nature published, or I was talking about a paper about Nature and how natural infection to SARS-CoV-2 seems to provide longer immunity. So again, this is just data, it's information that I think you should know about. So here's the deal. If you're experiencing long COVID syndrome or PACS, post-acute sequelae of SARS-CoV-2 infection, meaning you got the virus or you were vaccinated and you haven't recovered and you're now experiencing, a number of symptoms, fatigue, weakness, sleep disturbance, impaired memory, muscle pain, joint pain, chronic sore throat, tender lymph nodes, unresolved headaches, shortness of breath, loss of taste, smell, brain fog, rapid heart rate, or arrhythmias, you should consider the following. Number one, start with the basics and do not skip over the basics. This includes a balanced whole foods or anti-inflammatory diet. Don't make this harder than what it is. and do not complain. This is exactly what you need to be doing. Eat real food that you make at home. Stop with the takeout crap stacks of food. That is not giving you the nutrients that you need. Avoid foods that are refined or highly processed. Breads, pastas, things that are in boxes, right? Be careful with all those foods. Increase your physical activity. Go to bed and wake up at the same time every day. These are the non-negotiables of health. I'm telling you, do not skip over this. These are all things that must be done if you're feeling like crap and you know you need to recover. After that, purposely reduce your exposure to toxic load. This means literally go right now and look under your faucets, look in your medicine cabinets, clean up your drinking water. Don't drink tap water if that's what you're doing. I mean, go get a $15 filter if that's all you can afford. That's still going to be better than nothing. Look at your cosmetic products, your cleaning products, even your food products, and pay attention to all the chemicals that you're exposing yourself to. These things destroy your microbiome. Even if you're pro-vaccine and you want to get a vaccine, if you want to have a better vaccination, you should do all this beforehand. Really try to focus on boosting your physiology. Number 3, support your immune system. My recommendations are always to get what I would call a cellular health assessment via blood chemistry testing. This is where you're measuring B vitamins, vitamin D, what's your vitamin A like, your vitamin C, magnesium, zinc, and more. These are all nutrients that you should be looking at. And if your doctor's not ordering these tests, you should probably find a new doctor because that doctor's not really interested in your health. These are the basics of immunity. And in a pandemic, these should all be looked at. Now, you can take all sorts of fancy formulas and supplements, but if you're not getting the basics down, none of this is going to work. Number 4, I'd absolutely suggest glutathione supplementation. Again, chances are your levels are low. Most people in this country we're just exposed to all sorts of things. And finally, number 5, the most important factor is to address all root causes of abnormal physiology. In most long COVID cases, there was pre-existing health issues, diagnosed or undiagnosed, who were on the verge of illness, and the virus simply triggered or pushed them over. Of course, you should work with a knowledgeable practitioner or a doctor who can help you to uncover, the underlying causes of your inflammation, nutrient deficiencies, detoxification dysfunctions, food allergies or sensitivities, autoimmunity, which most people don't realize that they have, or other patterns of illness. And since everything is connected in the body, this whole person view is really the key for long-term health and vitality, and also overcoming long COVID syndrome. We really need to stop thinking so linearly in terms of our health. Linear thinking is my cholesterol is high, so therefore I need to lower it with a drug. Systems biology and functional medicine would ask, why is my cholesterol high? Cholesterol is an anti-inflammatory. Actually, cholesterol as a molecule lowers inflammation. Maybe you need to find out what's causing inflammation in your body and fix that. And once you do it, that'll normalize cholesterol. It happens all the time. Cholesterol is also important for hormone production. If your hormones are low, maybe your body's trying to compensate by increasing cholesterol. Maybe it's a liver dysfunction, which plays a role in cholesterol synthesis. In fact, 75% of your cholesterol that you measure from your blood is not coming from the food that you're eating, but actually from the liver. So what's going on with your liver? And again, if you only treat it linearly, if you only lower your cholesterol with a drug, your level's going to come down, but that doesn't mean you're any healthier for it. This is why so many people end up still dying from heart disease, even though they were taking their medication. It's because they didn't fix the problem. So the same applies with this virus. Just because you get vaccinated doesn't make you any healthier. And this is absolutely a contributing factor to why the most vaccinated countries in the world are still experiencing high death rates. And here's a news article. And again, this was published today, May 29th, 2021. This was in Forbes. And basically, in this article, they demonstrate how the highest vaccinated countries, we have a state where we have the highest vaccinated countries, and they're still dealing with high surges in death rates. Please do not assume that you're covered, you're okay just because you got a vaccine. Or certainly don't just assume that you're healthy because you don't have symptoms. Whether you get vaccinated or not, you should always be looking into your body and getting a report card of sorts. How's your fitness level? How's your biochemistry? What are your nutrient markers doing? What is your inflammation doing? And you take all that information together, and that's how you can then decide to come up with a plan on how to move forward. I really hope that this helps you out. Now go do good things.